Well, good morning or good afternoon, everyone. This is Joy Burkhardt. I'm the Executive Director of 2020 Mom, a national nonprofit that's working to close gaps in maternal mental health care. We're so pleased that so many of you have joined us today, or about 12 to 15 of you have joined us today, and so many more will be listening to the recording later. This is the fourth webinar in our Innovation Awards webinar series, and today we have the great pleasure of learning about our advocacy winner, the Innovation in Policy and Advocacy winner, a campaign called StrongMom StrongBaby. And with me today is Charlie Lotz and Ray. First, before we get in and introduce Charlie and Ray, though, I would like to just pause for a moment and give you a couple of quick updates. And we're going to actually ask that each of you take some time to let us know that you're on the line and what interests you in this topic. So let me start by announcing just a couple of things. There is one handout that was attached to the GoToWebinar control panel. So you can pull down that PowerPoint if you're interested in taking a look. You can download it directly, for those of you listening live. We'll also have the PowerPoint that's listed here available on the 2020 Mom website under past webinars. That'll be available tomorrow along with this recording. And any other handouts or things we talk about today, we'll also upload those to the 2020 Mom website, again, under past webinars. You'll be able to access that tomorrow. So let me take just a moment and invite each of you who is with us today to use the question feature on your GoToWebinar control panel and let us know what area, what state or city you're from, and also let us know if you're interested in policy and advocacy and maybe what your role is within your organization. So if you're a clinician, you're an advocate, again, your city, your state, and your interest in advocacy and your role. So great, we have someone from Bozeman, Montana. Sarah, welcome. And we know that Montana is reaching a tipping point, I have to say, with so many people becoming interested in maternal mental health. I think I heard that there are about 300 of you that watched the 2020 Mom conference or forum last Friday. So welcome, Sarah. We're so glad to have you. And Sarah is saying, yes, they're so excited in policy and advocacy. Sarah, thanks for joining us. And any others that want to introduce yourself, feel free to. You don't have to. You can use the question feature on the GoToWebinar control panel. So we'll wait for more of those to stroll in. Again, you're not, we'd love to just know where you're located and why you're interested in policy and advocacy. And feel free to input that at any point. So I'm going to go ahead and introduce our two guests today. There's a picture of myself up on the screen now. Again, Joy Burkhardt, I'm the Executive Director of 2020 Mom. That's how you can reach me. We also are so pleased to have Charlie Lotz and Ray Firth with us today. Charlie is the Associate Director at the Denny Civic Solutions, and we also have Ray with us as well. He is a consultant with Denny Civic Solutions, focused on researching policy, and we know that both of you have some great expertise. I would love first to turn it over to you, Charlie. Just tell us a little bit more about how you got into this work and your expertise areas, and then we'll turn it over to Ray.
Sure. Well, first of all, thank you again for having us. We're really excited to do this. Second of all, that was a lovely introduction. I feel like I can't help but let it down with whatever I'm going to follow up with here. But my name is Charlie Lotz. I work for a small consulting firm called Denny Civic Solutions, founded by my boss, a man named John Denny. And I came to this actually several years ago in sort of a roundabout way. I used to work for our United Way here in Allegheny County, which is where Pittsburgh is here in southwestern Pennsylvania, and got involved with an ongoing advocacy effort of theirs called the Campaign for What Works. And the Campaign for What Works is really designed around the idea of improving human services in Pennsylvania more broadly. And then that kind of tentpole organizing name of Campaign for What Works has spawned several different advocacy efforts, one of which is StrongMom StrongBaby. So in the interim, I moved from working from the United Way side of things to working with the consultant that they hired to really head up a lot of these efforts, John Denny, who's now my current boss. And that's more or less how I first got involved. I'm an advocate. I am newer to this world than Ray is, and his depth of knowledge really puts mine to shame. But I am an organizer. I do coalition development and management work, and also ongoing support and leadership for the Strong Mom, Strong Baby campaign. So I'll kick it over to Ray.
Hi. I've worked for about 40 plus years in various public human service areas. Approximately half that time working in county government, and in Pennsylvania, the county has a significant role in human services. And there I had worked for services for adults with mental illness, and a significant amount of work in the early childhood and childhood area for intervention services for children with disabilities. And then moved to the University of Pittsburgh to try to translate research into public policy, and was fortunate to work on this effort locally, which was a broad consortium of some really great leaders who came together to try to address maternal depression so that it could benefit services in the county would benefit both mothers and the babies. And then the Campaign for What Works gave an opportunity to translate that to a statewide benefit, which is what we're talking about today.
That's fantastic. Charlie and Ray, thank you so much. We know we have a lot to learn from you and are so glad that you're with us. Again, congrats on winning the Innovation Award for Advocacy. Let's start with, we know a little bit about you and that you bring great expertise to the table. I'd like to start with just learning a little bit about Pittsburgh. I have heard, and I hope I'm not putting you on the spot, but I've heard it's a great place for innovation because it's just the right size. So tell us, we heard a little bit about the fact that counties in Pennsylvania are given a great amount of power to move the needle in human services. Is there anything more we should know about Pittsburgh? And then we're going to move into kind of how this work started. And I think we'll get a flavor around the fact that there's some great community foundations and partners at the table. But Charlie, can we start with you just to hear a little bit about Pittsburgh? What is it like, so that those of us on the call can attribute some things that may be similar or different to our own communities?
Sure. So Pittsburgh is a really interesting case, and it is becoming pretty widely known for innovation, but I suppose it depends on what you mean by innovation. Pittsburgh in the past few years has really become a leading tech center, and we're a home to both Uber and their self-driving car initiative, and Google, and all of these tech-oriented companies. Now, when it comes to human services, I think the answer gets a little more complicated. I will say Allegheny County, which Pittsburgh is located in, has benefited from having a truly, I would say, visionary director, a man named Mark Cherna, who has consistently helped position Pittsburgh as a leader in the state of Pennsylvania when it comes to human services policy. And a lot of our programs that we develop here do ultimately end up being either adapted in other counties around the state, or and this is the case in Strong Mom, Strong Baby, we have to actively work to try and spread something that we're doing here in Allegheny County to the state as a whole. And we'll talk a little bit more about that when we talk about the actual legislation here. But I'll let Ray, as someone who formerly worked in county government, to really offer a more informed perspective here.
And also an older perspective as the old man on the call. Pittsburgh is part of Allegheny County, and about 1.3, 1.4 population. And it's a varied County, and also Pennsylvania, the counties in Pennsylvania run from very rural to very urban communities. And human services, from child protective services, mental health, aging, substance abuse, by and large are down to the counties for implementation, and then they pull together whatever federal money, state appropriations, and county money are available for those services. And I would go back further. You commented about the foundation community, and what my comment would be that as I've interviewed for jobs elsewhere, I make assumptions about the foundation participation. So one thing about Allegheny County in this area is we have a significant positive foundation community. Part of this grew out of the early days with Heinz and Gulf and U.S. Steel and that history, but that has continued. That foundations make significant support financially, but also leadership. The foundations are oftentimes challenging public human services or identifying issues, whether it be people being institutionalized or lead poisoning or child abuse issues. They will oftentimes be the one of the pushers for that. The second, I would say that our current human service director for Allegheny County is excellent, but he's really built on a foundation. Allegheny County in the past, starting roughly in the 60s when a lot of the legislation on human services passed, were more than willing to take full appropriations. Many counties didn't want to take the money because they didn't want people with disabilities moving into their communities. But two, Allegheny County was prepared to sue the state of Pennsylvania if they didn't think things were going well, and that was particularly for people who had been institutionalized. But also on things like early intervention and how Medicaid gets managed. Allegheny County has had government leadership, nonprofit agency leadership, foundation leadership that was prepared to fight to do it in a way that they thought was better than the state may be requesting. So it's been a strong foundation, and I think this project was a good example of that. There was amazing collaboration between the Medicaid agencies, public mental health and early intervention leaders, nonprofit organizations, and pediatricians, obstetricians, family medicine physicians. So there is a sense of collaboration and being prepared to move out and do it on your own. And the foundations were the ones who got this started in the beginning, concerned with maternal and child health services in Allegheny County weren't what they should be. And as we had progress through this, were the ones who nominated us for funding from Robert Woods Johnson, which allowed us to try some new efforts, take some risks, make some mistakes, and then move on. So it is a good area for human service development and innovation.
That's fantastic. Thank you so much for the introduction to Pittsburgh. I do think that there are some unique qualities about Pittsburgh that some on the line may not know if those same qualities exist, but we'll discuss some of that as we wrap up today's session. Let's segue to, and Ray, you teed this up very nicely, how you got your start. And so StrongMom StrongBaby, we know, is a hashtag and part of a larger campaign, which includes legislative advocacy. But can we step back a little bit and tell us again about the two foundations that I understand, just again, folks on the line, the foundations are legal entities that can contribute funding to social good causes. And so the two foundations that I believe I understand were instrumental in wanting to address maternal mental health, perhaps part of a larger picture to start helping sort of convening. And this is where maternal mental health started to bubble up. So tell us a little bit about United Way and the Pittsburgh Foundation and kind of what this convening really entailed.
Sure. So we'll talk a bit about those, but to even give a broader context, we're going to step back and bring in a couple more foundations as well. So United Way and the Pittsburgh Foundation were the two founding and driving forces behind this campaign. But stepping back here, Ray is going to talk a little bit more about the origins of this whole effort and who was involved in this initial effort called the Helping Families Raise Healthy Children Initiative. And just one more quick note before I turn it over to him. Stacy was nice enough to post a link to the message board to the RAND publication summarizing this effort that Ray is going to be talking about. So I believe everybody should be able to see it, and I think it'll also be included after the fact for people to access. But you can actually read a full summary of this analysis we're going to be referencing here at that link. So with that said, Ray, I'm going to turn it over to you.
And let me start by saying I'm going to highlight a few leaders, but I'll be leaving a lot of people out. This was a beautiful collaboration among lots of funders and others. The three foundations that at the top of the list here, one was the Heinz Endowments. And Heinz had, again, stepping out saying Allegheny County is not doing what we ought to be doing for maternal and child health, whether it be infant mortality, whether it be maternal mental health issues, children's development issues, from a broad perspective on maternal and child health. They really kicked it off, identified a few quality researchers that we have in the area that we brought in, but insisted that families and mothers with depression be at the table, that it not just be a top-down effort. And that was a very strong recommendation from the initial funders. The two next funders who came in, who are the big insurance companies, and we have two huge insurance companies here who are fighting day in and day out in a variety of ways. But they came together and both were jointly sponsoring our effort, even when we were making mistakes, and have moved it forward for continued funding, and that's helping us move it statewide. One is UPMC, and they manage the Medicaid funding in this area, both for behavioral health and physical health. And we're both leaders in encouraging us to do it right and focus on outcomes, and both financially and by people investment and changing their services. Their competitor in our area is a Highmark, and the Highmark Foundation was one who saw what we were doing. We walked in to give them a progress report. They stopped us halfway through and said, I don't want to hear all that. We have to take this to scale. Why don't we sponsor you with Robert Wood Johnson Foundation? So Highmark and UPMC, by not only financial investment, but by leadership, and in the case of UPMC, changing the Medicaid services, and let me just get very specific there. One is to essentially create mobile outpatient mental health services, because one of the barriers was moms with a young child getting to mental health, both because of stigma, because of looking at the adult's mental illness only and not looking at the child's development, and just the mechanics going somewhere with a baby. Funded mental health services that could go into the home and partner with our early intervention folks who are keyed on the infant's development. So yes, we had it, but for our listeners, I would say that looking for those champions particularly on the Medicaid side, it's easier to work with because of their obligations. But looking within them to find out who's interested in women's health, in mental health services and early childhood development, and thinks 2 generations, thinks not just about mom or just about the baby and the baby's development, but appreciates the interaction of the two and the importance to do, and how to modify our services for practical barriers like just getting to a mental health outpatient program. I hope that was responsive.
I think so.
It was very responsive. Yeah, go ahead. Go ahead, Charlie. I'm just taking notes very fast and curiously, and we'll get some of these great quotes from you, Ray, and Charlie, you too, I'm sure, up on our social media page, by the way. So good stuff. Thank you. And Charlie, go ahead.
Well, I was just going to ask if Ray could drill down just a little bit more too. And then, so we had this initial coming together of the foundation community and our insurance providers here locally. And then this translated into a concrete analysis, which is what we've linked here, which was done by the RAND Corporation that resulted in this effort called Helping Families Raise Healthy Children. And that report had a couple of key findings that I'm going to let Ray summarize here.
So we did go through a couple different stages of trying to get things better. The other driver in this was the frustration of pediatricians and family medicine physicians who were delighted to be doing the screening, but then it was like, so what? Then what? How do we help mom and the baby get the services? Who's going to be willing to do that? And we tried different models. Ultimately, the model we came to, and you can tell me if this is where you were focusing, was, and I'm going to add a little here about the early intervention program. And in this context, it's that program which is initiated at the federal level through the Individuals with Disabilities Education Act. But it looks at the development beginning at birth and early intervention Part C for infants and toddlers, 0 to 3. And it's different in the sense that it's a very family-friendly oriented. It's focused on doing in-home visits, and they serve children with lots of different developmental issues. They may have Down syndrome. They may have been abused. They may have been homeless. All these things that impact that child's development. But their model is to go where parents are, go and integrate the parents in the services and look at both the parent need and the infant's needs, and then to engage in other services. So they would see lots of mothers with mental health problems and begin to work, how do we integrate it, whether it's for mental health services, for clinical, or it's a domestic violence issue, and how do we begin to make that connection with that other service, or is it quality child care? But being able to go into the home, get down on the floor and talk to mom about her baby, how's the baby's development going, how's she doing, how is she sleeping these days. It's a very natural combination, and it helps deal very effectively. That was one of the outcomes that we clearly found out, is what we want to have is someone who is concerned both about mom's health, or other caretakers, but most of the time mom's health, the baby's health, and other children who may be in the home. So they have to be concerned about the family and the 2 generations, if you will. We look at who's got a good working relationship with the physicians, particularly pediatricians, because mom's not their patient, and the early intervention community, that they've already got a working relationship, that they have to be able to do outreach via home visits, and focus on the family's strengths, not just their weaknesses and what may not be going well at the moment, but what's going right at the moment. The other lesson that we got was that outpatient mental health people who tend to be serving the adult and are focused on the adult and they can't leave the office, their delight and being able to partner more effectively, because they may be serving mom with depression or other mental health issues, to have that early intervention folks that they can partner with, either just with parent permission, et cetera. And to know that someone is going into the home and taking a look at both, and if mom's comfortable with it, sharing that conversation. Yeah, let me put there for the moment.
And I'm just going to back it up just real quickly to the 1,000-foot level here, where essentially the origin of this entire effort was we knew that children whose mothers have who experience depression are at increased risk for neglect and a number of other risk factors. And so the real effort of this, the real end goal of this entire effort was to try and simultaneously improve outcomes for the infant to mitigate those factors from the mother being depressed, and also ensure that moms are being connected to the mental health services that they need. So that was the entire convening reason for this entire effort. The end result of this, I should mention, was that the maternal referral rate after a positive depression screening went from a baseline of 52% up to 62%, which is a marked improvement. The really amazing thing here is that of those referred, the actual follow-up in mental health services amongst mothers went from 37% to 71%. It almost doubled. And the real key here...
Charlie,
Yeah, go ahead.
I was just going to say, I'm going to ask you to repeat those
Sure.
success metrics in a minute. Go ahead and finish that thought, and then I want to recap, because you've shared such great information, both of you, about kind of how things got started, and I want to recap for folks, and then we can jump into some more details around initial goals and project funding. Go ahead,
Sure.
Charlie.
So just to tie a bow on that, the goal was really to, again, as Ray alluded to, addressing both moms and babies, improving outcomes for both. And this initial study looked at a couple different models, and it really was they found that by going through this early intervention system, as Ray mentioned, they were able to make that connection between providers that was able to effectively catch both moms and babies. And that, again, is part of the reason why we have the name Strong Mom, Strong Baby, because the associated legislation, which we'll get into in a little bit, really is designed to help both.
This is so great. And I don't know if others on the phone are like, what's in my head is like a timeline. And I feel like we're, what I see at the front of the timeline, from the old school timelines that we used to do in elementary school to move up to present, but starting. Charlie, I should ask you guys, or maybe Ray, a question for you is, what year was that initial, when did you, from it sounds like the Heinz Family Foundation, and then the two insurers, UPMC and Highmark, wanting to do this convening and kind of fund exploration in this topic. What year was that?
We got started simplistically in 2002 is when Heinz initiated the work. We went through 2 pilot projects, and each time we had some success but wanted to get better. And then in 2009, we started this phase using the early intervention system as the entree point, both for physicians making referrals, voluntary referrals, and screening within the early intervention system itself, because there's a higher rate of depression among moms with a child with a disability. And so that began in 2009, and then our final report that the RAND Corporation put out was 2013. And then I retired that year, and the Campaign for What Works was looking for issues to be able to take to a state level. Allegheny County maintained this service, and it's fully operational, and a couple counties replicated it. working under the same state model, state guidelines. And so then Campaign for What Works folks and I talked about taking this policy recommendation, which is one of the recommendations that came out of the work, to say, okay, let's go in, and knowing that the state legislation, we could find champions to amend Pennsylvania's legislation that it fulfilled the federal requirement to amend that in the category of children who are at risk, and thus we would like to screen and track those kids to see if they do have any developmental issues, they can get in quickly to serve them and amend the legislation. And the campaign had done this just previously with homeless infants. And we found that even though we have a conservative General Assembly, that we were able to do that for a modest amendment to the early intervention legislation to enhance access for children and their parents when they are at risk for homelessness, or in this case, at risk for depression.
So that was in 2014 that that we had homeless infants added as a qualifying category for early intervention services. And then our bill was originally introduced in 2016, which is actually when I came on here. So talk about good luck. I got to walk into 14 years of work building up to this moment of actually introducing the legislation, and I get to do the final part. So really standing on the shoulders of giants here. But so our bill was introduced in 2016, and we have been trying to get it advanced through our legislature since then.
That's great, and I have made a little timeline for myself, and I think we will actually create some sort of visual for folks. Why this is important, many of us, I think, come to this space ready to do something and address this issue through advocacy, just like legislators are really ready to do something. But what your story tells for me is that it can really, if you want to do this and do this where you're going to have built a coalition around you to support the legislative advocacy work, which we'll talk about in just a moment, that there's sometimes, a lot of groundwork behind the scenes, and you've laid that foundation for us. I really love understanding that it started with Wise Foundation, Family Foundation. So those of you on the line listening, one of the takeaways, and I think, Ray, you hit on a couple things. One was to introduce yourself and the cause to the Medicaid agencies in your state, or if your state is one, which Ray and Charlie, I think there's just a handful of states that really give their counties the same authority that Pennsylvania does. California is one where I'm based, but most of the work is actually driven at a state level in most states. So I think even starting at the state level is not a bad idea if you don't know the answers. So whether your counties do have this kind of authority, but to start at the state level and approaching what I see and hear from you and really agree with is starting with approaching your Medicaid state agency to say, do you have this on your radar? And we've got a CMS memo that was released, it feels like just last year, but it was in 2016 around maternal depression, which I'm guessing Ray and Charlie, you knew well. And then the second partner is family foundations, I think, and maybe not just limited to family foundations, healthcare foundations, but it does seem like our family foundations are often maybe a couple steps ahead of other foundations who are more conservative because perhaps there's less sort of approval requirements and such for them to take on issues. And so, Ray, Charlie, any thoughts on that? Just that it started with perhaps leveraging your family foundations and your agencies for Medicaid?
Well, so as not to bore you too much, I had left some of the earlier pieces out, but your point on working with your the state Medicaid agency, I think is right on. In fact, we had worked, it was a different we at that point, but when I was working at the office at University of Pittsburgh, we had approached the state Medicaid medical director. And that medical director, unbeknownst to us, had already made the requirement for his contractors that they, A, do the screening, but B, that they had to make an effort at engaging a community agency. So that was just the beginning of kind of making that a more sophisticated process. Then the Pennsylvania's Secretary for Human Services went further and put money behind that to say that they could get rewarded, the Medicaid agencies could be rewarded whenever they've got successful engagement. And that has driven the Medicaid agencies to a fair extent. And they also have the authority on the early intervention side to make these eligible services to make that happen. So yes, our opportunity to work as an Allegheny County entity was a huge advantage to us. But B, your recommendation to get to know your state Medicaid agency and know the Medicaid rules and flexibility, and the human service side for early intervention as well as mental health is extremely important. And the other foundation I would recommend looking at it, and I don't know if this is occurring elsewhere, is both community foundations that may be working at a much smaller level that could put some seed money in. And the other is to take a look at, as healthcare has evolved in your state or community, in ours, when hospitals have closed, foundations have been established to address health issues in their communities. So be another category of foundation to look at.
And I would add as well, United Ways, and again, we were essentially an outgrowth of this partnership between our local United Way and the Pittsburgh Foundation. But United Ways increasingly, I think, are moving towards this model of trying to get more actively engaged in advocacy. There's kind of a shifting role for United Ways across the country in recent years, and I think this is something that they're moving more and more toward. And again, something we were extremely lucky that we have a particularly forward-thinking and robust United Way here in southwestern PA.
That's really helpful, both of you. And again, really, I think tease up the fact that this didn't happen overnight. The bill that that we'll move to in just a moment was not introduced overnight. A lot of legwork and groundwork was laid. It's not to say that we can't introduce legislative solutions right away, but perhaps there is, there's something to be said for doing it this way. And I will point out that there are, quite a few. If you don't mind, we'll tee up and provide a little introduction to folks around other states that have addressed maternal mental health with just a legislative solution. And I think it's important to think about those states and how Pennsylvania differs, and the process that they went through may differ from other states. And so the two leaders in this space, the states, and there's really three, but the two initial states that addressed maternal mental health were New Jersey and Illinois, and actually in reverse order. And there's been some research published on the success of those legislative campaigns, and I think it's fair to say great people behind that legislative advocacy, but not sustainable results. There was research published on the New Jersey mandate to require screening for postpartum depression that shows that screening doesn't lead to treatment. Just screening alone, there's much more involved. And so I do think it's really important to hear this background, even though I think some of our attendees listening live or the recorded session may be ready to jump in and work directly with their legislature now. And so this is why it's really important, I think, that we hear kind of all of the work that was put into this effort. And so let me just recap something briefly. I think we've learned that there were several early partners that started to look at maternal child health and then maternal depression as a component of an impact on early child development, the 0 to 3 period, which really pointed to this program around early intervention. And so you had an opportunity with support from several foundations to test, and I say you, I don't mean Denny Civic Solutions necessarily, but the community in Pittsburgh and Ray, I think you've been involved from the very beginning to test that this sort of early intervention model around home visiting and early detection for risk and getting mom and baby into treatment was tested, and then a legislative solution was brought forth. I'll have you confirm that that's the case, but also then just want to introduce HB 200, House Bill 200, which is the legislative solution. And so why don't we, Charlie, turn it to you, and then if Ray, you have anything else to add on that point, we'd appreciate it. So Charlie, why don't you recap, confirm what I said, and then recap, what is in HB 200? And Stacey, we will include a link to that bill, that actual bill, when we post our recording on our website.
This is Ray, and I'm going to use my senior status to jump in. Just to your point on New Jersey, I think was at one of our starting points is that we can screen, but then what? But that the model that we came to look at was from how do we measure progress from screening, referral, mom accepting a referral because stigma is such an issue, and then measuring engagement. And if you work with an early intervention and a Medicaid program, you can essentially look at their data on the appointments that people have kept as a way to see whether you're making those 3 steps. So I think that screening, referral, and then engagement is an important model to think about. And I will quit and we'll talk about House Bill 200.
Sure. So
really great.
I think Ray's background here is really helpful to know about what led to all this, and then I'll jump in to really kind of talk about how this is transferred into actual legislative action here. So we actually have 2 bills that we're promoting, House Bill 200 and Senate Bill 200, and they're identical bills. They're trying to accomplish exactly the same thing, identical language, everything. But as a general rule, we like to get things introduced in both chambers, and that essentially doubles our chances for being able to navigate it through one or the other. Sometimes you hit snags in the Senate and it's going to move better in the House. Sometimes the opposite is true. So first of all, what the bill actually does is relatively limited and pretty simple. All it does is add an additional qualifying category for early intervention services. So as it stands, there are 6, and we're trying to add a 7th to that list. Now, as Ray alluded to a little bit earlier, Campaign for What Works, which is the parent organization here, back in 2014 did this exact same thing with homeless infants by getting homeless infants added as a qualifying category. We are now trying to add another category to the early intervention statute in Pennsylvania. Now, once we have the idea of how we want to approach this legislatively, which is making this connection through the early intervention system, and again, limiting the scope of it, because legislatively, small change is a much easier sell than big change, as much as we like to think that sweeping changes are possible in our state and federal governments. Incremental tends to happen a lot more. So once that happens, once you know what you want to do legislatively, the really key step, and I can't emphasize this enough, is getting legislative champions who are going to move this bill for you. And there are a lot of factors that we considered before we actually reached out and had the 4 champions that we currently have serving as the prime sponsors and prime co-sponsors on these bills. First and foremost, all four of our champions, and their names in the Senate are Senator Bartolotta and Tamara Bartolotta and Senator Judy Schwenk. In the House, it's Representative Tara Toohill and Representative Mike Schlossberg. All of them in one way or another have a personal connection to the issue. Senator Schwenk's daughter experienced postpartum depression, for example. Representative Toohill is both a foster and an adoptive mother, but even with her non-biological children, she experienced a lot of symptoms of depression that would be comparable to postpartum depression for mothers after giving birth to their children. Representative Schlossberg, for example, is one of the co-founders of our state mental health caucus and has had his own issues with depression. So there is a personal connection here for these four legislators. Another key factor is you have to look at the makeup of your state legislature. We have Republican majorities by a pretty hefty margin in both the House and the Senate. And so our prime sponsors in both the House and the Senate are Republicans. However, we want to make it clear that this is bipartisan. It's a win-win for everyone. And so our prime co-sponsors in both chambers are Democrats. And the other thing that you want to consider, there are a couple other factors, for example, where they're from in the state. A lot of times, because we're already doing this in Allegheny County, you don't necessarily want an Allegheny County senator or representative leading this charge. You want someone who is going to be in an area that's going to benefit from the expansion of this program. Also, just the way our legislature works, sometimes things seen as coming exclusively from Pittsburgh or exclusively from Philadelphia are viewed very warily by our state legislature because we have a whole lot of land in between Pittsburgh and Philadelphia, and a huge portion of our General Assembly is made up of folks who are not from the two cities. And so when you think about the balance of power, having somebody outside a city can be really key here. But at the end of the day, the thing that really drives it is, are these champions going to be willing and able to fight for this legislation? In an average 2-year session in our General Assembly, you have 4,000 to 5,000 bills, I believe, that are introduced. If 10% of those ultimately become law, that's considered to be a productive, successful session. And so you need a champion who's going to fight for this tooth and nail to cut through that noise and make this a priority. And I'm very happy to say we have 4 phenomenal champions who've done exactly that. They've made this an absolute top priority, all 4 of them, and have engaged with us on this from the very beginning. They have reached out to their colleagues in the legislature and have tirelessly fought for these bills from the very beginning. So I cannot stress that enough, how important it is to have one of these champions. And on a final note to that, once you have them and once you have done initial engagement, it's really important to keep them invested, to keep them fighting, and to give them as much positive feedback as you can. And so to that end, over the last year, for example, we organized a series of town hall events in the home districts of these 4 champions, hosted by the local United Ways and community foundations, where they invited experts, local experts in the field to talk about issues of maternal depression, about early intervention. We had pediatricians, family medicine doctors, we had nurses representing Nurse-Family Partnership, we had early intervention specialists on these panels. And at these town hall events, we essentially have a Q&A session with them. We have these experts weighing in on how the system works, what it looks like, and how this legislation would actively benefit them and their clients. And these were hosted and moderated by our senators and reps who are sponsoring the legislation. So it became a feedback loop here where the champions are A, learning even more about the issue than they know already, B, are getting energized, and C, we have extensive press coverage, social media coverage of these events so that they get some really wonderful positive attention in the media for what they're doing, which is great for them, and also gets a lot of positive, incredible coverage for the bill and helps create public awareness for it and ultimately helps us get these passed. So I'm going to pause there, but when it comes to transitioning it to the legislative phase, I think those are the real key factors.
That's great. And we're taking notes. We're going to make sure, I think our advocacy panels, this panel presentation, things can get a bit more complicated than in our other two presentation categories, which are community-based services and clinical-based services. And that's the nature of advocacy, isn't it, Ray and Charlie? Advocacy, they say, is an umbrella, not just legislation. And so you're really telling that story for us. I'm taking great notes. And I think we'll want to document some of this for our followers, and particularly for those who are tuning in and who we know are ready to go deep. So this is really helpful. What I'd like to do, though, thank you for reminding us the importance of finding sponsors. And it sounds like you were very pragmatic about finding the right sponsors in both parties to make sure it was supported by both Democrats and Republicans. I do want to find out, Charlie, before we move on, how did you find out who had personal experiences with these disorders? Did you all send out a crew to just kind of connect and put feelers out? How did you do that?
I think it's probably a combination of factors, but we're extremely lucky to work with some government relations folks in Harrisburg that have very good relationships with our senators and representatives. One of our government relations specialists is actually the former Secretary of Human Services for Pennsylvania, and has a great relationship with a whole lot of senators and representatives. I think a lot of the linkages were made there. And Ray, I don't know if you have anything to add to that.
Yeah,
you were there a little bit more when those linkages were made.
Yeah, two points. That one is we got started even a little bit earlier when the Mental Health Caucus first got established. This relationship we had, they invited us in, and we kind of asked to come in, but to say what they wanted to know, what should they address. And so we were able to come in very early on. And the second point, Charlie had to go through it quickly, but if you haven't done this work in a legislature, you cannot believe how many bumps in the road there are. And so, you need to have a relationship. Charlie and I were on a first name basis with their staff, and they'd call you at 7 o'clock at night and go, hey, someone just asked yada yada. Can you have something for me for their meeting tomorrow morning at 10 a.m.?
Yep.
And so you had to do a quick one-pager in lay language that responded to that question. And there was no, let me get back to you in a week. And just the strangest things that would pop up. Something may occur. The committee's going to see this tomorrow morning. Well, there was an accident on the turnpike or something, and you get bumped. That legislative aid in that office has got to come back to say, so when's it going to come back on the agenda? It never quits. And so having committed champions in the legislature, relationships with their staff, and you have to be prepared to jump on a moment's notice with something you don't think is relevant to them. They needed to keep things moving.
And to their credit, too, they're an almost astounding willingness to work together across the aisle on this. And something I should note, too, since Ray mentioned the Mental Health Caucus here, Mike Schlossberg, again, who we mentioned, our representative, who's one of the founding members of that, this was initially his bill. Mike is a Democrat. He understands the makeup of the General Assembly in Pennsylvania, and so was willing to and this is something that is truly, truly incredible if you work in government relations, was willing to step back and allow his colleague, Representative Tara Toohill, who's a Republican, to really take the lead on this, because he knew that coming from a Republican, considering the makeup of the House, would be ultimately more effective and would increase the chances that the bill actually gets passed. And that is a truly astounding thing, and we've seen that time and time again from those champions, the willingness to work across the aisle and to take the lead when needed and take a back seat when needed as well.
Great. I mean, exactly why maybe they were elected into office, right? Is that there was some trust that they have the greater good in mind and not just their own reelection, right?
Exactly.
It's not always the case, but sometimes is. So that's great. Thank you both for that. And why don't we? We're going to open up for questions for those that have questions. But before we do, what I'd like to hear you talk about, Charlie, is the multi-pronged approach for engaging lawmakers. You kind of hit on the sort of direct government relations, which is really what most of us think of as sort of lobbyists, people who are paid, who will go in and really know how to do this work, like the two of you. But you also, in your application for the award, talked about earned media, which we know. I think the StrongMom StrongBaby campaign and the social media work around this really elevates so much of the foundation you've laid, and then grassroots engagement. Can you touch on those two things?
Sure. Yeah, so I do view it as more or less a three-pronged approach, but with three prongs that really end up intertwining with each other to a certain level. So as you mentioned, part of it is this direct engagement with lawmakers, and that involves visits to Harrisburg, and we most definitely do that. However, a huge component of this entire thing has been developing and managing and continuing to benefit from an extremely large and diverse coalition of organizations that are supporting this legislation with us, that are part of our StrongMom StrongBaby coalition. So we have over 40 groups around the state of Pennsylvania that have signed on as coalition members. We have bi-weekly calls with all of them, where we give them feedback, updates on where the bill currently stands. We solicit their input on approaches. We take advantage of any relationships that that organizations in specific parts of the state may have with their state representatives or senators. So if we have an ask, then we know who we can go to talk to a representative in Allentown or a representative in Erie, Pennsylvania, for example. We are able to work through our network to have them reach out on our behalf, and that carries more water, either because of the name of the organization carries weight, or because they have a pre-existing relationship with these legislators. So I cannot stress enough how important it is to be able to have a coalition like this that's able to carry water for you as well, so you're not just doing this alone. And the other part, as you mentioned, really, and I think any advocacy campaign that you're going to be doing in 2018 has to have a social media component. It grants some legitimacy to your organization right off the bat, because if you're making a request to a legislator, a logical next step for a lot of them is to look you up. Who the heck is this group? Having a social presence, immediately gives you a sense of legitimacy. But B is really an incredible tool for connecting with both your coalition, connecting with moms and families who have their own personal stories and experiences with depression that in many cases they're brave enough to share. Those stories are extremely powerful, and something that when you're in a meeting, and this is how you can see how they intertwine. When we're in a meeting with a state senator, if we can say, this mother in your district experienced this firsthand, and this is what it looked like, that puts a human face on the issue for someone who has to deal with thousands of bills in an average session, and really helps lift this up to the top of their priority list. So the three prongs really overlap and inform each other. We have members of our coalition who join us in Harrisburg for Advocacy Days. So that's where the coalition and these direct advocacy efforts overlap. There really is an intertwining there, but I think you really need to have all three if you want to have a successful advocacy effort.
That's great, Charlie. We appreciate that. Let me back up as we look for questions that are coming in. And I did want to give a shout out to the others that let us know that they were on the line. We have representatives from, or we have not representatives as in assembly or Senate members. But
like, who's listening?
Yeah. What attendees? You can tell I have my advocacy cap on. We have attendees on today's session from New Jersey, from Colorado. We already mentioned Montana, and also DC. There's a couple others. Any Baby Can. I think you may be from California. But I suspect these are going to be, those of you who are listening right now, big champions in some way. If you've made it to this call and you're not overwhelmed by advocacy, that you're intrigued, there's a place for you in this space. And we'll talk a little bit about what 2020 Mom is doing in just a moment to help support you. Before we get to any other questions that you have and that kind of support infrastructure, Charlie and Ray, can you just touch on one thing we didn't really talk about is who hired you? Or after all that great initial work happens, right? Like often people are like, well, there's these two great men in front of us, but like it's odd, right? You're not an advocate that suffered, for example, like so many women that do this work have come to this field and advocacy for those reasons. But you are Denny Civic Solutions, and what we haven't yet discussed is how did we get from point A to point B, where really it's your organization now that's taking it to the next level and elevating this best practice into legislative action?
Sure. So I often lead with folks where I say, you look at me and you see a childless man. What's the first thing you think of? That's right. Strong mom, strong baby, right? So that's a question we get a decent amount. So I will say this. So again, I mentioned before the Campaign for What Works. And when I say that the United Way and the Pittsburgh Foundation were the founders of that, that's also to say that they were the funders of that. So they were the two organizations that came together about, I think it was 2011, 2012 that the Campaign for What Works got started. And in any given year, they identified a couple of policy priorities that they wanted to advocate for at the state level. And their goal really was to move from being, at the time we had a governor who was year after year suggesting cuts to our human services programs in the state. They formed as a response to that, but really wanted to make it a positive effort to promote the good work that our human services programs do, rather than simply a negative, don't cut us, don't cut us, don't cut us. So there have been a number of initiatives under that banner over the years, ranging from issues to address employment for young people with disabilities, for example, to working with the area agencies on aging across Pennsylvania to help seniors age in place. They've championed a number of different issues. Now, in terms of who hired us, go ahead.
And those issues pretty much got defined by something can be accomplished in 2 years that will be meaningful.
Yes.
So it wasn't change the whole way healthcare is delivered. It's
right.
What we don't like to use the term, but we were tweaking.
Yes.
And
actionable. The key word here is actionable. They always identified priorities that A, were going to make a significant positive change, but B, were small enough in scope that they could be accomplished. And that is something that's really key to think about when you think about the makeup of our state government in Pennsylvania as well. So in terms of who hired us, my boss is a man named John Denny. John has been involved in both running political campaigns stretching back to the 80s. He was a statewide presidential campaign director. And then for many, many years worked from the inside on the foundation side of things. He used to work for Elsie Hillman, who was a local luminary here for many, many decades in state politics, and was one of the Hillmans, whose names are pretty infamous here in Pittsburgh. The Hillman family foundations have long been philanthropic cornerstones in Pittsburgh. So that was his background. He started his own consulting company essentially to do things like this, which is to manage efforts. Most of our clients are nonprofits, foundations that are trying to accomplish a policy effort at the state level in Pennsylvania. Not all, but that is the bulk of who we work with. And so John was brought in to do that. And because I work with John, I initially got involved and became the head of this particular effort under that Campaign for What Works banners. So that's how I came to the Strong Mom, Strong Baby campaign. Ray has been involved with the campaign for What Works from the very beginning on a number of these initiatives and has served as an ongoing consultant for us throughout this effort.
Okay, fabulous. Well, I think on that note, because there's so many great roots of your work that we could really spend an hour on each of them and how this all came to be. I do think I have a couple of other ideas for webinars down the road, Charlie and Ray, that we might want to tap you for. But for now, we just want to again say congratulations on being the winner of the Advocacy Award. And you know what's really telling, I think, about your campaign winning this award is that it's not even a piece of legislation that has passed yet, and that's okay. We're recognizing all of the work that has gone into this to make sure that it's the right piece of legislation that has evidence base. It acknowledges that these things take time. And really, I hope you know that we recognize both of your areas of expertise. Ray, your 40 years in this field is just amazing, and I think you have a lot more to contribute to the field. Charlie, we know you're going to be a dad someday, and appreciate your expertise as well. And both of you, you're not going anywhere because we're going to keep you very close to this national movement. Again, congratulations. A big shout out to our funder for the Innovation Awards program, the Zoma Foundation. Again, we have one attendee from Colorado, I think with the Department of Public Health. I recognize your name and all the great work that you're doing in Colorado. The Zoma Foundation is based in Colorado and really interested in scaling what works, not just for Colorado, but for the rest of the country. Thank you, Zoma Foundation. And let me end on just one quick note that those of you interested in advocacy, we have a place for you. And I would love for you to actually email me right now, all of you who are attending. I should be able to pull up your email addresses later as well. But if you're interested in staying connected around advocacy, we're launching a learning network very soon that really one of our foundational learning circles or collaboratives will be around advocacy and how to take what other states are doing, like Pennsylvania, and utilize those best practices. So we don't have to spend the 15 years necessarily. We've got to do groundwork, but we don't have to spend 15 years in our own home states to do what we know is going to work because Pennsylvania has already done it. So email me, joy@20mom.org. I hope, Charlie and Ray, that is sort of the highest compliment to Pennsylvania and all of those who've been involved in this work. Again, thank you. And I'm going to leave the last comments to both of you, Charlie and Ray. Anything else you want to say before we close out today?
I think we both just want to express our enormous thanks to you and to the incredible work that 2020 Mom continues to do, to the Zoma Foundation for supporting this, and to everybody for attending. We really appreciate getting a chance to share this with all of you.
Thank you.
Great. And thank you so much, Ray and Charlie. You're going to be part of the Learning Network. You don't know that yet, but thank you for your contributions.
Is that a promise or a threat?
Both. Thank you, gentlemen. Thank you, everyone, for joining us today. We will be back online next week, actually, with another Innovation Award presentation. So please plan on joining us. And thank you all for your contributions to maternal mental health. Thanks, everyone.
Thanks so much, Joy. Thanks, everybody.